ABC Listen app.
Now, if you're anything like me, then I'm sure you know at least one person who has had COVID in the last few weeks. It seems like it's everywhere right now. So what should you do if you start to get cold symptoms, and when should you be testing? Dr. Michael Page is the president of the WA branch of the Australian Medical Association. Hope you're fit and healthy this morning, Michael.
Oh, good morning, Christian. Yes, I'm feeling fine, but like many listeners, I know many people who've had COVID in recent weeks.
Yeah, I'm one of those people, and I work in another office at the moment too, and it has been decimated. So, do we know any information? Because we don't actually need to report our cases anymore, do we?
That's right. So reporting's not mandatory, but we do still have good data that's collected by WA Health. So the government agency in the public health branch does collect good data from not only testing that is done formally through pathology laboratories and the occasionally reported rat test, but also through the wastewater surveillance program, which is a very good ongoing program whereby sewage is tested for fragments of the genetic material of the virus, and by doing that, we know not only roughly how much of it is circulating, but also which variants are circulating. So what we can see at the moment is that yes, we've just been through a significant wave. We are actually on the downslope in the last couple of weeks in terms of the amount of virus that's been detected in wastewater, and also the positivity rate of formal individual clinical testing, but what we also see is new variants. It seems like each wave we have one or two new variants. So we've got a lineage of variants at the moment called KP, which are part of this so-called flirt sub-variant lineage of Omicron. So we're continuing to see new variants.
Okay, so how fast is it morphing? Because I remember in the early stages they were saying, wow, it's morphed a lot. Does it slow down? Has it slowed down a bit?
Oh, look, I would say what we have at the moment remains Omicron. So you remember early on the very first strain of COVID that emerged in Wuhan in China and spread around the world was Alpha. Then we had something called Delta. Delta was particularly virulent. In other words, it spread very quickly and was also quite dangerous. The Omicron variants that we've been seeing ever since, which is now a couple of years at least, maybe 2-3 years that we've had Omicron variants as the predominant strains. There have been a lot of subvariants of those of Omicron, but it just has to pick up one or two little mutations and then it gets a new name, and those mutations might make it a bit more likely to escape the protection provided by vaccines. It might make it more or less dangerous, but typically not more dangerous. We haven't really seen any more dangerous strains emerge, and we also know that the vaccines remain good protection despite the ever-changing nature of the virus.
So there is some good news there, but if people are waking up this morning and they're feeling a little unwell, what should they do?
Look, rat tests are still worth doing. So you don't want to be going to work and spreading the virus around if you can avoid it. So rat testing remains a good initial option. Formal respiratory testing via a pathology laboratory remains the more reliable option, but you need a request from your GP. And of course, stay at home if unwell. Those people who are vulnerable, who've tested positive by a rat test or formal laboratory testing, so people who are over the age of 50 with other risk factors, anyone over 70, anyone who's of Aboriginal ancestry are eligible for the drug treatments, the antiviral treatments, which although they don't cure the virus, can make it less severe, perhaps make it less likely that you'll end up in hospital, and shorten the duration of symptoms as well. So again, worth a chat with your GP if you test positive and you fit into one of those risk categories to see if you might be eligible for antiviral treatment.
Okay, so I'm one of the people who had it just about 3 weeks ago. What are the protocols about when I should get a vaccination now? Because don't we retain some natural immunity for a period?
You do. Typically, a booster dose is recommended if you haven't had either a booster or or an infection in the wild for a period of time. So that might be 12 months for lower risk people, 6 months for higher risk people. So I'd suggest to anyone who's had a recent infection and is thinking about getting a booster dose, just Google the WA guidelines on COVID-19 vaccination and you'll find the most up-to-date information. But typically, if you've had a recent infection, you don't need to get a booster. On the other hand, if you haven't had a recent infection, and this was me a couple of months ago, I hadn't had a booster for about 12 months, and I was about to go travelling, and so I went and got a booster just on the off chance that I picked up COVID. Again, the boosters, as we've sort of all learnt over the last few years, the vaccination doesn't completely stop you getting COVID, and it doesn't stop you transmitting COVID, but it does make the symptoms of it a lot less severe. It prevents hospitalisation, prevents ICU admission in those people who are prone to getting severe disease. So it remains a very worthwhile strategy. And while you're at it, get the flu vaccine if you haven't had it yet, because we haven't had the flu wave hit WA yet. But it's absolutely going like wildfire in the eastern states.
Thank you for that advice, Michael. I've got to make way for the news now. That's Dr. Michael Page, the president of the WA branch of the Australian Medical Association.